Lifespan serves older adults and family caregivers. We've been around in the community in this region of Rochester for over 50 years. My name is Anne Marie Cook, and I'm President and CEO of Lifespan of Greater Rochester. We have two statewide programs, the New York State Elder Abuse Coalition and the New York State Caregiving and Respite Coalition, and we have 30 different programs and services to serve older adults and family caregivers. We serve about 30,000 older adults a year. When we connected to the Rochester Rio, at first it was very simple. We got alerts when our clients went into the hospital or the emergency room, and now it's so much more. We're able, with of course client consent, to go into the portal to look for lab results that would help them. Our nurses can do that. We also, and this is critical for us, utilize the Rio in a lot of our evaluation methods.
My name is Annie Wells. I'm the Division Leader for Healthcare Initiatives at Lifespan of Greater Rochester. For my program of Community Care Connections, they've been able to do some data matching with our client records. We send an extract to the Rio. They match ED visits and hospitalization encounter data to our records. They de-identify it, and then they send it to our evaluator, New York Academy of Medicine, who then can analyze the data to show pre and post changes in ED visit and hospitalization. And it's been very significantly helpful to us because we've been able to prove the value of our intervention in connecting people to the services that they need.
My name is Jody Owen, and I'm the RN Co-Director for Community Care Connections. And I supervise a team of LPN healthcare coordinators. We know our client is discharged from the hospital. We're able to then schedule a home visit, talk to the client to make sure they understand the discharge instructions to prevent that re-hospitalization. That's our goal.
When we're working on a case and we can get information in real time about alerts if somebody's hit the hospital or ED, that makes our work so much easier. We immediately contact discharge planning and social work at any of the area hospitals to say Lifespan's involved, we're connected to this client, let's work together on an appropriate discharge. And we can make sure that plan's in place before that older adult leaves the hospital. It makes a huge difference in the lives of older adults, it makes the transition easier, and it makes our work easier.
I would strongly recommend using the Rochester Rio. It really helps us integrate our services with healthcare.
Without Rochester Rio for our team, I think we'd see a lot more readmissions back to the hospital.
Honestly, our partnership with the Rochester Rio has been critical to our work, and it's really given me an opportunity to see the importance of integrating community-based aging services with healthcare, especially for older adults. Electronic access for our staff members has become critical. As a matter of fact, I'm not sure they could do it anymore without it.
Rochester Rio is one of New York State's regional health information exchanges that comprise the Shiny, which connects healthcare providers across the state to improve patient care and outcomes.